At Jielin, I've been fortunate to have the opportunity to be involved in many different extracurricular activities during my pre-clerkship years. Some of my major ones include leading the internal medicine interest group and the point of care ultrasound interest groups. And I was also involved in the student council for both of my years of pre-clerkship. And I feel that these activities have given me experience with leadership, which will be valuable in my future career. I've also been involved in Let's Talk Science, which is a club that educates younger students regarding science and how it can benefit them in their career. And I've also been involved in the Western chapter of the STEM Cell Club. And those activities have provided me experience with teaching and communicating complex science ideas in simple terms to the general public. And lastly, I've also been involved in altitude mentorship and continued my mentorship role in an engineering club where we train younger students in building robots. And those activities have helped me develop skills in mentorship, which will be valuable later in my career when I start mentoring younger physicians. I believe that the ability to educate patients about their diagnosis is a very important skill that physicians need to develop. And there are several opportunities throughout medical school that our students can use to develop this skill. In pre-clerkship, I personally have been involved in the Let's Talk Science Club and the Western chapter of the Stem Cell Club, which have helped me develop skills in this aspect. And my friends have been involved in many other clubs at Jielin, such as the Teddy Bear Hospital, the Youth Action Center, Healthy Responsible Sexuality, the Neuroscience Outreach Group, and all of these activities provide them training in communicating with the public. Moving forward, later in medical school, something that would really benefit most students is to find mentors who really excel in teaching and learn skills from them. Observe their patient encounters and see how they explain new diagnoses to the patients and absorb some of those skills and techniques and employ them in our own future practice. And along the same lines, as we become more comfortable with it, we can also start trying to explain new diagnoses to patients ourselves and then get feedback from the patients, ask them some questions to test their understanding of the explanation that you just provided. And through this iterative process, we can continue to improve our skill as an educator. And I believe that in the long run, this will improve patient outcomes as well. I've had many amazing experiences at Jielin, which I will remember lifelong. In first year, I vividly remember the orientation week. I met a lot of my friends and built a long-lasting relationship. I also really enjoyed the Ontario Medical Student Weekend. It was organized in Queens that year. In my second year, because I enjoyed those experiences in first year so much, I decided to volunteer in the orientation week as a leader to welcome the class of 2020. And I was also involved in the OMSA planning committee when it was held at Jielin the following year. In third year, most of my memorable experiences have been around patients. I have met many amazing patients with great stories to tell, and they have really drilled down some important concepts about illness experiences that patients go through. And I believe that those memories will stay with me and guide me in being a better physician. Lastly, in fourth year, I've had the opportunity to visit several different universities in different provinces during the electives tour and learn about how healthcare is delivered slightly differently in different places and bring some of the good concepts and good approaches that I've seen there with me and incorporate that in my future practice. I did an undergrad in engineering because in high school I decided that I love both engineering and medicine and I wanted to pursue this route. Ultimately, my goal is to combine engineering and medicine and hopefully do research in technological innovation. During undergraduate in engineering, I was involved in many biomedical type research projects where I first started getting involved in combining the two disciplines together. I continued that in medical school, where the research opportunities that I sought were related to involving technology for patient care. I was also involved in developing many websites and using my skills in software development, and I found that that was a very productive way of me continuing some engineering during medical school. First year, I decided to join the Schulich Research Training Program, which is an opportunity where we are paired with the researcher and we work with them for 2 summers in a row. I joined the Gait and Brain Lab at Parkwood Institute, where I was assigned to work on a project involving non-invasive brain stimulation for improving the cognition and gait of older adults. The project is still ongoing, but during my time being involved in the project, we had great results, great preliminary results, and it's quite promising. And should that pan out in the future, we may have a very safe and effective way to improve the quality of life for older adults, which I'm quite excited about. A research project that I'm continuing to work on with the Gait and Brain Lab involves developing an app that uses the observational data that has been collected by the lab over the past several years to make prediction about the risk of progression of MCI to dementia based on the gait performance of older adults. If this app is validated and it's found to be effective, then it can be a valuable clinical tool to stratify the risk of different older adults and provide personalized treatments, which hopefully improves outcomes. A project that I'm currently working on with OMSA involves developing a web platform for the Ontario Student Medical Education Research Conference, which is a new initiative by OMSA to provide opportunities for students involved in healthcare fields to present research in the field of education.